So welcome to today's healthcare webinar on engaging and supporting youth who are caregivers in clinical interactions, sharing the RISE UP Toolkit for healthcare providers. My name is Stacey Dawes. I'm the Health and Community Engagement Lead at Family Caregivers of BC, and I'll be your host for today's webinar. Before we begin, please take a moment to familiarize yourself with the meeting controls so you'll be able to ask your questions and share your experiences. For most of you, the meeting controls will appear at the bottom of your screen. Today's session will be presented in a webinar format with limited interactivity, so your video cameras and microphones are turned off, and we will only be using the chat box today. However, we definitely want to hear from you, so I encourage each of you to have your chat box open and to type out any sort of questions and comments as our presentation moves along. So to get us started, I would like to respectfully acknowledge that Family Caregivers of BC operates on the traditional, ancestral, and unceded territories of the Lulunkan people, also known as the Songhees and Esquimalt First Nations. I am presenting to you from my home office in Port Moody, which is located on the unceded traditional territories of the Coquitlam, Musqueam, Squamish, Stilo, and Tsleil-Waututh First Nations. At this time, I'd like to introduce today's presenters. Dr. Karen Orankic, I hope I pronounced that right, is a practicing general internal medicine physician at the University Health Network and health sciences scientist at Toronto General Research Institute in Toronto. Isabel Cavan is a research associate working with Dr. Orankic and a current first-year medical student at McMaster University. She brings her lived experience as a young carer to this project. So thank you both for investing your time today to speak to us on the RISE UP Toolkit and how it can be used in clinical practice to recognize as well as support young caregivers.
Thank you. Wonderful. Thank you so much for having us. So we'll get started, everyone. I'm hoping my slides work. So Karen and I are part of a very large project team and have had a lot of support from a lot of different scientists and community organizations like Family Caregivers of BC who have given a lot of time and energy to this project. And we also are very grateful to have international advisors on this work. And I myself, as mentioned, have kind of my own experience as a young carer, but I'm especially privileged to lead an advisory group of other young carers who bring really diverse experiences to this project and have been really invaluable in shaping the toolkit and everything we've learned so far. So to kind of introduce young carers, they are caregivers who, there's a few different kind of definitions, but ours for this project is caregivers who are under the age of 25 and are people who provide what can be fairly significant caregiving support to a family member or a loved one. And the data kind of from the numbers around young carers is fairly old. And so the 10 years ago, the estimate was over 1 million across Canada. And this number has likely grown since. And as we kind of turn our lens towards caregivers more and more in the healthcare system, we are appreciating the kind of lack of recognition that all caregivers can sometimes experience, but because young people may not fit the kind of traditional mold of what a caregiver looks like, they can also experience more significant kind of under recognition and under awareness, and have kind of struggles with navigation, coordination, and advocacy as caregivers in their roles with the healthcare system. And when they're not supported, can experience a lot of negative consequences. Being a young person at a really pivotal time for their kind of personal growth and development without kind of adequate support, caregiving roles can lead to kind of challenges with mental and physical health, lead to young people kind of dropping out of school or not being able to maintain employment, and other challenges with their kind of individual, professional, and personal development throughout their lives. And as we know, they kind of take on significant healthcare related responsibilities. And so I will hand off to Karen to kind of speak to some of these.
So a few years ago, we conducted what's called a meta-ethnography. That's a fancy word for reviewing the literature for qualitative studies. So when we reviewed 28 previous studies published in the last 15 years on young carers' interactions with healthcare, we concluded that there was a lack of recognition and acknowledgement of young carers, and that young carers felt uninformed, unprepared, and did not know what to expect, despite providing and often being present for point of care tasks during home, clinic, or hospital visits. These young carers needed us to raise awareness about their roles and focus supports. So I, as mentioned before, am a general internist. I'm not a pediatrician. I'm not a family physician. I really thought prior to being involved in this project that I hadn't really thought about a young carer, and that in my practice, I probably didn't see any. And when I started hearing more and more about their role, I started recognizing them a lot more, whether it was that teenager in the emergency that was sitting next to my patient, whether it was the younger child who was often helping to answer, translate and answer questions when I was doing a history. Sometimes it was the young adult who was there and really helping learn about insulin administration, for example, when we were getting ready to send someone home. So I'd like you to just kind of look in and just think about your own clinical practice for those of you that are clinicians on the call. And maybe just write in the chat if it is active, how have you met a young carer in your practice? And if so, what have you learned about their role? And the questions are really just to help you ground your own practice, and hopefully that'll help. With the reflection will help with some of what we're going to present next. So I encourage you to all read some of the chat, and we'll just move on to the next slide as people are putting in their responses. So we set out to understand the views of healthcare providers, and we did this by using a previously validated survey from Europe to obtain a wide range of responses on the awareness of and challenges in recognizing and supporting young carers at point of care. We sent this survey around through our caregiving organizations and their listservs, also posted on social media, and ultimately then got all these findings, presented these findings to a group of healthcare providers, community caregiving organizations, and young carers. And together we worked through co-design to build a resource based on the gaps and challenges that we identified in the survey. So what we saw in the survey was, if you can see there on the left, that we had 450 responses. They represented a wide range of disciplines and practices, with the majority coming from Eastern and Western Canada. The majority on the right, you can see that healthcare workers were familiar with the term young caregiver, young carer. There were a few other terms that were used, and acknowledge that they did encounter young carers in their clinical practice. But a much lower percentage responded that they were able to support them or refer them to caregiving organizations. What was very interesting was that 34% of our respondents had themselves lived experience as a young carer.
So Karen kind of briefly touched on our there's our slide, our co-design process. So I won't spend too much time kind of explaining what this looked like, but we had a really engaging and dynamic series of workshops that we held, as Karen mentioned, with young caregivers, with healthcare providers, and with organizations who are doing really important work in the space, to kind of look at our data and figure out what we could kind of build together to address some of these needs. And these conversations were very, very interesting, and I think it spoke to a lot of the kind of nuances in this work in terms of the challenges for a young person themselves having to interact with the healthcare system, and then also kind of our current state of our healthcare system with providers maybe not having the kind of capacity to do the recognition or having the tools and being equipped with kind of what that support looks like. So our toolkit ended up focusing on this idea of how we can really integrate both this idea of recognition and support. The young carers who were at the table spoke to sort of what it meant to be in a healthcare interaction and have a healthcare provider who was able to kind of acknowledge and affirm that they were taking on a really significant caregiving role, and to just kind of feel seen. But at the same time, from their kind of perspectives that they shared, being seen but not having any kind of connection to resources or further support was sort of a frustrating experience. And then I think really interestingly, on the flip side, we heard from healthcare providers who spoke to this idea of kind of wanting to do that recognition, wanting to do that affirming support, but struggled to do that when they didn't have the tools and resources to kind of connect this idea of recognition with support. So where we really landed was trying to embed both of these really important concepts in supporting healthcare providers to engage with young carers. And our resource toolkit is directed specifically to healthcare providers to support their kind of learning around recognition and support. So it's not a resource for young carers, but it's a resource for providers. So what I'll be doing is, for the next little bit, is actually kind of walking you through the toolkit and what we've built together, and how to use it. And so as Karen kind of walked through our survey data a little bit, what was really great about this is that through co-design, we were able to kind of work together and pull out the kind of key pieces of our survey data and what was meaningful for healthcare providers and what would be something that was impactful for them as they're kind of working through this toolkit. And at the end, it kind of connects to resources, which I'll show what that looks like. So you may have seen and noticed a big piece of pie on the front page. And so one of the suggestions, actually from one of our young care advisors, was that in medicine, there's a lot of acronyms. In healthcare, there's lots of acronyms. And so we kind of had this idea of building this acronym that encompassed both recognition and support. And so the first word of the acronym is PIE. And the idea is that we're encouraging providers to kind of look at what is on a young person's plate. And as a young carer, this plate can often be kind of overflowing and overburdened. And encouraging them to kind of ask questions to help get a little bit of more sense around that person's responsibilities, how they're navigating those responsibilities, and really importantly, kind of how they feel about those responsibilities. One of the things that we talked a lot about is that being a young person and providing caregiving support isn't an inherently negative thing. What is negative and what is challenging is doing that caregiving support while they kind of aren't supported or they're totally overwhelmed and overburdened. And so how can we kind of help a provider look at what's on someone's plate and then pass it along? And then Karen, I don't know if you had any comments for this piece.
I was just about to say, for the pie piece, to me as a healthcare provider, the pie piece is the most important piece. It's almost like what we use for triaging. When I recognize now in practice a young carer or someone that might be a young carer, even before thinking in my head about all the possible resources and what they might need, you really don't know until you ask about, using the PIE acronym, proximity, intensity, and effect, what that person might need. It may be peer support. It may be just someone to listen and acknowledge their role. It may be even just helping them recognize their role. So to me, the PIE piece of the acronym is the most important first step.
And I will kind of break down the acronym as we go through, but then to kind of explain the other piece of the acronym is that when we talk about support, we framed it around this idea of PASS. So partnering, affirming, systems, and support. So it's really kind of figuring out, you've recognized what's on this young person's plate, you've talked to them how they feel about it, and what kind of piece of that pie can you kind of take off their plate through connection to resources that can kind of make it more manageable, and what on that young person's terms do they kind of need and are they looking for in terms of resources and support. So to kind of break down the kind of pieces of the acronym, so as Karen talked about, the kind of high piece being this really kind of grounding piece in this recognition. Proximity asks really kind of who is around the patient in terms of kind of their family care team, who is providing care support. And what was really important about this work and having an advisory group of young carers who all brought really different lived experiences is the kind of nuance that is needed as part of these conversations. We talked a lot about this kind of young care label and how for some people, having someone kind of recognize them as a young carer and say you're a young carer can be this really kind of affirming moment of, oh, I am a caregiver. Like I do take on these responsibilities. But for other young people, whether that be kind of due to individual, familial, or cultural values, having that kind of label assigned to them isn't something that is kind of aligns with their values and may actually kind of promote further stigmatization rather than asking about care kind of from a more general lens of kind of who provides care, who in your family provides caregiving support. What does that kind of look like within the family? There may be situations where it's just the young carer themselves who's taking on a lot of these caregiving responsibilities, but there may also be a lot of situations where it's kind of shared within the family. And how is that family kind of managing these responsibilities? How is that impacting that young person? And so these questions don't kind of ask specifically, are you a young carer, but rather kind of what does care look like for this person, for this patient, and who is around them providing support. And the next piece is intensity. So we talked about a little bit about that kind of overflowing piece of or pie on their plate. And really this idea, as I touched on before, that where young caregivers experience challenges is this kind of overwhelming intensity of caregiving responsibilities at the same time as they are, maybe finishing high school, maybe starting post-secondary education, maybe trying to find a job, having other kind of really important life transitions that happen when you're, 17, 18, 19, etc. And so I think this idea of intensity and the questions that we have outlined in the green boxes, I think is really important to kind of respect the kind of autonomy and agency of the young person of, how intense is your care and how do you feel about that? And really kind of centering that young person in understanding the intensity of their care responsibilities and how that kind of fits in with their life. And we also highlighted in the kind of pink box on the left there, different examples that we saw both from previous research and our survey of different types of tasks that a young person may take on in a healthcare interaction. Karen mentioned the example of interpretation. That was something we heard a lot of through the survey and at co-design of that type of responsibility that a young person takes on in healthcare. But then also kind of what are some examples of caregiving support at home? And for some people that may be kind of like watchful monitoring, providing emotional support, taking on more of the household responsibilities, doing finances, etc. So just providing examples of some of the types of care responsibilities. And then the E of pie is effect. So asking kind of what the impact of those care responsibilities are of that young person, areas where they may kind of need some support, and how is the kind of care responsibilities and maybe potential associated challenges showing up kind of at school, showing up in their personal life, showing up in finances. One of the things that we heard that just a really important or a simple thing, but for a young person, maybe really important is just a healthcare provider being able to kind of write a note for school absences or some sort of explanation for why assignments are late or things are not on time. And so asking kind of where those impacts are can also help to kind of pinpoint where the support is needed. And then really understanding just the kind of existing challenges that young people face. And then I think also importantly, kind of highlighting also the positive aspects of caregiving. I think that's important to kind of always call into play. It's not as I mentioned, kind of inherently negative things. There's really wonderful things about two people kind of caring for each other and in different ways, and how we can kind of provide that support so that care can go on in a way that is kind of sustainable for everyone in the relationship. And then I will go through the PASS part, and Karen, I'll have you chime in kind of from the clinical point of view as well. But this section, now that we've learned about what's on their plate, is really focused on kind of what can you do as a provider. And so this idea of partnership is something that's been emphasized in a lot of caregiving research across ages. And I think the reason why we have the recognition piece first of this pie is that healthcare providers may not kind of know to partner with this young person because they don't see them as a caregiver. And so there may be people in the room who the patient wants to be kind of included in those communications about circle of care, or there may be important things that that young person knows about the patient and their history and what life looks like at home that are really important to ask about because they have so much expertise from their experience as a caregiver. And then really also, while the toolkit is focused on the young person and their needs, being cognizant, as I talked about earlier, of kind of the whole family and how they are impacted as well in their contributions.
Yeah, I'll just
And
add
Karen,
something here, just as a, so as I mentioned, I'm a general internist, so my patients are all adults, and I've really been, the conversations I now have with my patients about children in their household and how those children are involved in their care, I think has really almost improved the anxiety and the mental health and the physical health, and just having that discussion with my patients. You can just sense that having that discussion on how I can help their family, coping and learning and being educated about everything that's happening, the diagnosis, the prognosis, what to expect, and any treatments and plans. Really, there's that burden that's removed from the conversation often, is what I sense.
for sure. And then the next letter of PASS is affirm, which I'll kind of quickly go through as I've touched on it, but really just kind of recognizing and providing that validation of the responsibilities that that young person is taking on, and that they are kind of heard and valued and seen in the kind of caregiving responsibilities that they're doing. And then also kind of, affirming and acknowledging potential challenges in the situation can be a really, really meaningful step of just kind of naming what you're seeing and naming that this person is actually providing support and is a really integral part of the support for this patient. And then as we kind of move into our resource table, which I'll walk through really quickly, is this kind of combined systems and support piece. And just recognizing sort of the simplicity and the importance of asking kind of what do you need and how can I support you? As I mentioned, that could be like a note from school, or that could be a referral to peer support groups. But I think the systems piece comes in recognizing that there's lots of things that may not be kind of feasible for a healthcare provider to do and to help that person with, but being able to kind of refer them to other organizations and other resources that can help address some of those long-term needs. And then just noticing and seeing, this awareness building within our healthcare system. So is a really important step in making sure that we can actually kind of connect recognition to support and actually work with that person to figure out kind of what they need. And so what is at the end of the toolkit is a really kind of broad overview of different resources. So what you can do as a provider looking through it is figure out kind of what province you're in. And then when you're asking that person what they need, this kind of horizontal or vertical lines on the right side outline different areas where resources provide the support. So whether that's kind of informational support that could be about a specific condition, for example, a parent with a mental health challenge, whether that's emotional or peer support, and whether that's specific support related to kind of healthcare navigation, this toolkit kind of outlines existing resources and whether they're available to anyone in Canada, whether they're in person or virtual. And then you can see kind of at the top right here from our survey, we've actually kind of called out what healthcare providers shared in terms of what they see as important for young carers and what they see as important for resources to address. And there's a really growing kind of momentum and resource building happening across the country for caregivers, but ensuring that they address these ideas of health literacy and cultural competencies was something that was emphasized from providers who filled out the survey. And so I won't walk through all of the resources, but I will kind of highlight how to use it, and there's a link that you can use to get that resource and share it with that person. And then on this last page here, there's also a few separate things that we've identified. So there aren't a ton of financial resources for caregivers. So we have kind of included them in a separate box here because we know that is a really, really important challenge that young caregivers navigate. And while the kind of young person you're interacting with may not, as Karen mentioned, may not actually be your own patient as a healthcare provider, we've also linked the integrated youth services hubs that are growing across the country that address mental health and substance use support for young people. And they're a really great place to kind of refer out for more individual mental health needs. And then the last call out I'll show at the bottom is there's really fantastic work happening in Alberta to support caregiver-centered care education for healthcare providers. And they have really extensive education and modules and really great videos that we've seen for healthcare providers to learn more about caregivers of all ages. And so some really great kind of further education there if you are interested in. And so we had, I think, some Zoom integrated questions, but we heard a little bit about where people are from. I'm not sure if we can get that kind of last question about, we had a question related to kind of how likely, oh, there we go. If you could kind of share how likely you are to use this toolkit in your practice, why or why not, that would be really, really helpful for us for sharing it. And then, as mentioned, really the toolkit, we want to kind of get it to as many healthcare providers as possible. As folks at Family Caregivers BC mentioned, we'll share this resource with you afterwards so you have access to the toolkit. And then as part of awareness building, what we are releasing in a few short weeks is a really cool graphic narrative, kind of comic strip style that highlights a young caregiver's journey through healthcare and where some of those challenges lie and how the toolkit can address some of these challenges in a really kind of visually engaging way to help build some of that recognition and awareness. Karen, do you have any kind of concluding remarks to share? I'll pass it back to you.
All good. Thank you so much for attending, everyone, and please send us your comments.
Yeah.
Well, thank you, Karen.
Thank you so much.
Yeah, thank you, Karen and Isabel, for an incredibly enlightening presentation, on the impact that we can make when we truly validate and include and support young caregivers. We appreciate your dedication in just bringing a lot of light and care to this often unrecognized and definitely undervalued role, as well as providing the PI tool as a really useful strategy. I haven't seen this before, so this is really, really cool. It's a really useful strategy that we can integrate into closing that gap that you commented on between the recognition of young carers and the offering of support. So we really appreciate you taking the time today to be here. Your lived experience, your experience in working with patients and families. And I thank you all for your attention and investment for the participants today. As in the chat box, we will be following up with an evaluation and resources attached to this webinar. So thank you all, and we hope to see you again.
Wonderful. Thank you so much for being here and for having us.